Your kidneys are filtering 200 liters of blood every single day. And right now, without any pain, without any warning, 5 foods that most people eat on daily basis could be cutting that filtering capacity by up to 40%. Here is what makes this truly dangerous. Your kidneys don't send you a pain signal until you've already lost 60% of their function. Not 10, not 20, 60% gone before you feel a single thing. Hello, I'm Dr. Ngunti, a medical doctor and a fitness enthusiast. And in the next couple of minutes, I'm going to show you exactly which 5 foods are doing silent damage to your kidneys right now. And I'll give you the simple 3 switches to stop it. But before we go through the foods, I need to explain one concept because it changes everything. Your kidneys have something called reserve capacity. That means they can keep functioning normally even while being quite damaged right up until that reserve runs out. Nephrologists call it compensated kidney injuries, but I call it the silent cliff. You feel fine, and then you don't. This is exactly why around 37 million Americans currently have chronic kidney disease, and 9 out of 10 of them have absolutely no idea. The food I'm about to show you don't cause pain, they cause inflammation, scarring, progressive nephron loss. Your nephron, those are the microscopic filtration unit inside your kidneys. You have about 1 million in each kidney. Once they are damaged, they don't go back. Now let's go through all those 5 foods. Number 1, processed meat such as bacon, deli turkey, hot dog, sausages. Now you've heard these are high in sodium, and that's true. But sodium is only half the problem. What nobody tells you about are the phosphate additives inside them. Most manufacturers add inorganic phosphates as preservative and flavor enhancers. Check the label, you will see words like sodium phosphate or potassium phosphate. Here is the clinical reality. Your body absorbs up to 90% of inorganic phosphate from processed food compared to only 40 to 60% of whole food source like egg or chicken. When blood phosphate stays elevated, it hardens the small arteries feeding your kidneys. It stiffens the vessels. It directly scars the nephron. A 2017 study published in the Journal of the American Medical Association found that eating processed meat 4 or more times per week had a 37% higher risk of kidney failure, not kidney disease, kidney failure. The swap is simple. Choose whole, unprocessed food like chicken breast, egg, wild caught fish, and check every label for the word phosphate. Number 2, sodium and energy drinks. I know you've heard don't drink soda, but I want to show you the exact mechanism because it's not just about sugar. Dark sodas such as Coca-Cola, Pepsi, and most energy drink contain phosphoric acid. That's what gives them the sharp, tangy bite. When phosphoric acid hits the bloodstream rapidly, it raises your uric acid level. And high uric acid doesn't just cause gout in your joint, it actually crystallizes inside your kidney tubules, which are the tiny tubules carrying filtered waste. Think of microscopic sharp cutting through kidney tissue every single day. A Harvard study followed over 3,000 women for 11 years. Those drinking 2 or more sodas daily had a 30% faster decline in their kidney function. Energy drinks are actually worse. The caffeine plus high niacin combined with dehydration effect of caffeine as diuretic. If I had a patient coming into my office with a spike creatinine level within 48 hours of binging on energy drinks, my clinical rule would be take maximum 1 can per week and 0 is always better. Number 3, and this one is going to sting, especially if you are watching because you are trying to build muscles after 40. Excess protein supplement. Now I need to be precise here. Protein is not bad. Your body absolutely needs protein, but there is a threshold your kidneys are built to handle, and when you chronically push past it, you cause something called hyperfiltration. And hyperfiltration means your kidneys are literally running at 130, even 140% of their design capacity just to process the nitrogen waste from excess protein. Over months and years, that sustained overload creates the same type of scarring that uncontrolled high blood pressure does. A landmark study in the Clinical Journal of the American Society of Nephrologists found that animal protein intake more than 1.3 grams per kilograms of body weight per day significantly accelerate kidney function decline even in people with only mild reduced kidney function. If you are 40 or over, your kidney reserve is already declining at roughly 1% per year. You cannot afford chronic hyperfiltration on top of that. My clinical recommendation is to take zero point 0.8 to 1 grams per kilogram of body weight. Prioritize whole food protein over powder. Cycle your protein loads and don't max out every single day. And if you want to know exactly how to structure nutrition for muscle after 40 without damaging your kidneys, that full breakdown is coming in the next video. Hit the subscribe button so that you don't miss out. Number 4, ultra processed packaged food and the hidden sodium bomb buried inside them. Your kidneys are your body's primary sodium regulators. Every time you eat sodium, your kidneys filter it out. The World Health Organization's safe daily limit is 2,000 milligrams, while the average American consumes 3,400 milligrams per day. Here is the part that surprises people. Only 11% of that excess sodium comes from your salt shaker. The other 89% is already inside the food before it reaches your kitchen. We are talking about canned soup, instant noodle, frozen meal, salad dressing, even your bread. A single serving of canned soup can contain 900 milligrams of sodium. That is 45% of the entire daily limit in one bowl. When your kidneys are constantly overloaded with sodium, they compensate by raising your blood pressure, and high blood pressure leads to hypertension, which is the number 2 cause of kidney failure in the United States. And this is why I call it the double hit protocol, working against you. The food raises the blood pressure, and the blood pressure silently kills your kidneys, both happening simultaneously every single meal. The rule I would give any patient is that if the sodium in milligram is higher than the calories per serving on any label, simply put it right back on the shelf. Number 5, alcohol. And before you say, but red wine has antioxidant, let me stop you right there. No level of alcohol consumption has been shown to protect kidney function. The antioxidant data comes from polyphenols in grapes, and you can get those from actual grapes. Here is what alcohol actually does to your kidneys, the mechanism most people never learn. First, alcohol is a diuretic. It suppresses a hormone called ADH, your antidiuretic hormone, forcing your kidneys to dump water faster than your body can replace it. And chronic low-grade dehydration causes tubular ischemia, which means that the kidney's tubules don't get enough blood flow. Tissue starves and therefore tissue dies. Second, alcohol metabolizes into acetaldehyde, which is the compound that reduces direct oxidative stress in kidney cells. A 2021 meta-analysis in the journal Nutrition found that even moderate alcohol consumption, defined as 2 to 4 drinks per week, was associated with measurable albuminemia. And albuminemia, that is the leaking protein in your urine. And that is the earliest biomarker of kidney damage that gets tested for in clinical medicine. And here is a toilet test I'll teach. If your urine is constantly foamy, especially in the morning, that is protein. That is your kidneys losing the filtration battle. So, 5 food, 5 biological mechanisms all working silently against your kidney function right now. Now, here is the part I don't want you to miss. I'm going to give you what I call the kidney shield protocol. Three clinical switches you can flip starting today that will measurably protect your kidney function over the next 90 days. Switch number one, label scan. Every packed food you buy, scan for two words first: phosphate and sodium. If the sodium milligram exceeds the calorie count per serving, it stays on the shelf. Switch 2, the morning flush. 500 milliliters of water, that's about 17 ounces. First thing in the morning, before coffee, before food, before any supplement. This cleared the overnight weight concentration sitting in your kidneys tubules. It takes 2 minutes and it costs nothing. Switch 3, the weekly protein audit. Once a week, log your protein intake for a single day. If it's constantly above 1.2 grams per kilograms of your body weight, you are hyperfiltrating. Reduce the powder, keep the whole food. There you have it. Three switches, 90 days. Your kidneys will thank you. One last thing, and this is important. If you are over 40, you need to know your GFR number, your glomerular filtration rate. It's a simple blood test that tells you exactly the what percentage of kidney function you currently have remaining. Most doctors don't order for it unless you ask. Ask for it on your next appointment and write that down. If this video showed you something your doctor has never told you before, the next video you must watch is to know and to recognize the sign that your kidneys are failing. The link is right below. I upload every Tuesday and Thursday with the same depth of knowledge. I'm Dr. Bundi. Thanks for watching, and I will see you in my next video.